So you can have universal health care without the state being the sole provider or the sole funder.
For me, my family's back in Canada. I'm more familiar with the Canadian system, but I am different in that I do see flaws in the single provider socialist system that we have, because it's not really sensitive to market structure. It's not forced to innovate per se. But the reason I set up that private surgical system in Winnipeg was that you got paid so much to do fusions that these less complex day surgeries, which is what most of the injured workers needed, would just fall by the wayside, and they wouldn't be seen for like 2 to 3 years. And when I found out that there was this big backlog of these simple cases, I reached out to the provincial injured workers system, which is WCB, and I just said, you guys want to establish something? And it was immediate, because they had some of the worst spine outcomes in the country. But because you had a single provider, you didn't have the flexibility in the system to provide it. So that speaks to the fact that there is a role for private care.
So you can have universal health care without the state being the sole provider or the sole funder. So a low-income person in Switzerland has their premiums for private health insurance paid by the state, and they get to go to the same private hospital and get the same private room and the same excellent care as everyone.